Today, I'm excited to be joined by coach and revenue manager, Damaury Escotto. Damaury brings a vast array of experience over the last 15 years, going from dental assistant to hygienist to hygiene clinical instructor, and now she's a coach and revenue manager for Benco. Welcome to the podcast, Damaury.
Thank you so much for allowing me to come and kind of share my experience and my take in the dental field.
Yeah,
and
absolutely.
Thank you for having this space for people to be able to do this.
Yeah, thank you. Absolutely. It's my pleasure. I enjoy it, as I was mentioning to you before. And so let's have fun for 20 minutes and have a conversation. So,
and I like to talk, so that's always nice.
Yeah. 20 minutes is often the challenge, right? So first of all, I mean, that kind of gave the 30,000 foot overview of 15 years of your life there. So I know there's more data points. So maybe you can go into just a little bit more detail of kind of how you got started and what kept maybe prompting you to reinvent, I think, kind of to the next point.
Yeah, so I actually, when I first graduated high school, we were actually discussing how we always feel like we are meant to pick a field, right? We're always told, once you graduate, pick this, stick with it, and run with it.
Right.
And my decision at that point was realizing that I love science and I wanted to become a dentist, because even though I felt that I was very smart and skilled enough to say I wanted to be a surgeon, I also had this aversion to people dying on me. And I felt the dentistry was very safe. So once I moved to the States and had to pick a college to go to, I realized that my local college had the opportunity of a dental assisting program. And, you know, being somebody who didn't ever had anything to do with the dental field, it just felt like investing 1 year in education and then being able to see how the dental office actually worked was worth it. And once I did that and actually started working in a dental practice, I realized that perhaps being the doctor wasn't for me. It was a lot of responsibility. It was a very heavy hat to wear. And I really enjoyed working with the doctors and the rest of the team. So I did realize that fairly quickly that I kind of like what the hygienist was doing. They still have some independence. They carry their own license. They took care of their patients from start to finish instead of moving from rooms to rooms, right? And it really appealed to me to have that time to dedicate to one person on my own, kind of closer to what the dentist was doing.
Right.
So I decided to pursue that. So I went back to school, became a dental hygienist. And I think like most of hygienists started to feel the burnout, right? Started to feel like the operatory was the only thing that I could do. And it's a very well-paid career. And I think sometimes that can be a little bit detrimental because you feel like this is all your training and you need this very specific skill for it. And nothing else that you would venture to will pay you as well with an associate degree.
Right.
So I had to kind of start getting creative and start weighing my options of, is the money more important than, you know, my body or my ergonomics or the length of my career or my passion? And so I decided to pursue a bachelor's in occupational management and hopefully kind of make a transition to a more managerial or leadership role. And ended up actually getting the opportunity to teach and be a clinical instructor for dental hygiene, which was a great adventure. I loved doing it. And once I realized that I really love teaching and educating, which I did with hygiene as well, becoming a coach just kind of seemed like the best next option. I was working with a dentist again. I was working with the teams again, and being able to pour all the knowledge that I had acquired in, 15 years to other practices and being able to say, hey, this things really work. How can I help you develop and grow? And that was what I realized has been my passion, just helping teams develop and grow and, help with that leadership factor, I guess.
Yeah, that's great. A couple of things stood out to me in that. One is that you had the self-awareness to not only to know what you were drawn to, but kind of thinking maybe something that the doctor part maybe isn't for me, right? So I think that's a meaningful quality and skill set to be able to bring, to be able to notice where are my strengths, where are my passions, where might I thrive. But also you were willing to keep reinventing too. I mean, you were willing to keep reaching for something that was next rather than remaining someplace, whether comfortable or even uncomfortable, just remaining there because that's what you've done. So I just want to tell you, I'm proud of you for that whole journey, that whole process, and the willingness to go there and to reach for that. So yeah, good for you.
Thank you. It can be uncomfortable, but it's one of the things that, like I said before, you really have to sit down with yourself and kind of evaluate what are the values that you're holding and what is worth more to you in the long run, in the long term, and decide if you can live with that. Right.
Yeah. That's very good. Very good, especially for a young person, right? I mean,
who's that?
Well, you started this at least as a very young person, really. But so you mentioned a little bit ago about something that I think is very common in the profession, very common in life, I think, these days, especially, but very common in the dental profession, and that's burnout. So tell us a little bit about that experience for you and maybe how you see that affecting others in various aspects of dentistry.
Yeah, I think it's really important also to remember that in healthcare, it's like you are on customer service, but yet you are providing a service that is a basic need to most people, right? So not only do you have to treat people like they're your customer, but you're also providing this very important basic, life-changing experience. So one of the things that I noticed, for other people, looking from the outside, is that you stop to care. And I don't think that's something that in our careers in healthcare is something that you can afford to do. And once you start seeing that, then perhaps it's the time to evaluate if there's a need for a change. So when you stop caring, when you stop having that empathy, I think that's when immediately what you're doing in the day-to-day is just no longer satisfying you.
So when you think about stopping caring, what do you see preceding that leads to I'm having a hard time equally caring as much as I used to?
Well, I think that can be multidimensional, especially I think with pressures that we're experiencing now, in the home factor, right? But when you look at it in the business, I think a lot of it for me was being overworked, feeling like I had to fill in so many shoes at once. Mm-hmm. And that was really hard to accomplish when you have a very high standard for your own work. So for me to feel that I was doing 5 different maybe the performance of 5 different team members while still being one, right? Especially I think now when you have shortages in staff, you have people that kind of step up and start taking in more work and more work and more work. And we have the standard of my work is supposed to be looking like this and at this level. And you feel like you can't achieve that because you're just doing so much. So I think that to me kind of preceded a little bit that. It was just feeling like I was not meeting my own standards
of
what my job should look like.
Right. So if you had to give a tip or two for anybody who is in any position really in this dental journey, as to what they could do to get victory in the burnout situation, what would you say?
Well, I think there's 2 very important things. And I think one of them is that self-awareness we were talking about. Be aware of what you like to do, but also be aware of what you feel your strengths and your weaknesses are. Because if you're not in the proper role, then you're never going to thrive, right? So if you're doing something that you don't feel that's your strength, then you'll probably never get to that satisfaction.
Right.
But also, have the boundaries to be able to say, I have a full plate right now, but what can I move around to access the help this person needs, right? Don't just take in more work. Don't just be a yes man, be able to say, sure, I can help you with that, but I have these things to do. So which one can I renegotiate or postpone in order to take this extra load?
Right.
And I don't think we're great at doing that consistently.
Right. Yeah, I think you're right. I think that's good. It makes me think too about a tendency. I mean, we talk in terms of win-win outcomes in life, right? And I think we have a harder time. It's easier for us to make sure the other person wins and or is thriving, but not necessarily always that we are, right? So we're phobic to the notion that we would set up some sort of win-lose situation. I win, but you, my teammates, or you, my patients that I'm caring for, you're going to need to lose in that proposition. So we don't like that, but we have an easier time, I think, setting up lose-win situations to where I'll make sure you win, but I'm not making sure I'm winning, right? I'm losing something, and there's not enough self-care in the process, right? I'm giving up my own care while I care for you.
Right. And, one of the big sayings that I say all the time, and, I used to use it with my patients all the time, and then I had to remind myself, I need to apply this to myself, was that you cannot pour from an empty cup, right? Yeah. So you need to make sure that you're pouring into yourself, whether for you that is getting CEs, getting revamped, getting that new knowledge, doing maybe perhaps doing team outings where you're outside of the office doing something social together. So doing those things that will pour into yourself so you can continue to pour onto others.
I love that. Thank you. That's very good. That's very good. Well, also then you've spoken about healthcare kind of being a complicated profession. What can you explain or amplify that a little bit?
Yeah, of course. I mean, again, I just feel like you're in this complicated customer service relationship because you're trying to provide this customer with a positive experience, yet you're perhaps not telling that customer a positive thing. You're giving them what most people would consider bad news, right? Something is wrong, right. Something needs to get done. Right. I just actually saw some statistics that were saying that 9 to 12% of Americans stop going to the dentist due to fear and anxiety. So specifically in dentistry, we don't have the greatest reputation.
Right. Yeah.
And 9% doesn't sound that big until you realize what 9% of 3 billion is, which is the American population right now.
Right.
But so you're providing this experience and this service, and still having to educate, and still having to tell somebody perhaps that news, and then find a way where even within that, you're still offering that service and that attention. And, we do a lot of things that are extra in order to allow that patient to return and not increase that anxiety that was already there, or those preconceived notions about what the dental office is.
Yeah. And for that bad news, they're also going to have the news of many instances of what that will cost them to. Exactly. So it's like on top of that bad news, it
compounds.
Obviously, we're not presenting it in that framework, but
yeah, and that's usually the big 3 things that people will have as their barriers for their dental care. It's going to be finances, and it's going to be time, because we're all running around. And then the other part of that is going to be fear. So you need to determine which way you're going to tackle this, because all these 3 things could happen at once, right. Just like they could happen independently.
Right. Yeah, that's true. So in the midst of this complicated profession, right, in the midst of maybe wearing multiple hats and all this stuff going on, especially in the current time, talk to us a little bit about what you feel like or what makes up a good team. So how do we have a good team in the midst of some of these circumstances we're talking about?
I think the first thing is really realizing who your doctor is. Because at the end of the day, you know, the doctors in any practice are really going to be the ones driving the values of that practice and the mission of that practice, right? When they develop their business, that's what they did. And one of the things that I really learned really early on in my career was that having empathy for those doctors, because I think a lot of times we feel like they're the doctor, they're the owner, they're better off than all of us.
Right. Yeah.
And, you know, the main reason why I said I didn't want to become a dentist later was because I realized that the responsibility that's within them is so humongous. It's such a big weight.
Right.
And just having the empathy to realize this is a person that went through so many years of schooling and training to do what, you know, you're hoping they love, right? To do what they want to do. And then they get told, by the way, now go ahead and open a business, be a team leader, and we're not going to tell you how to do that, but you go ahead and figure it out.
Right, right.
So I think we forget that these are people that are not, they're now being driven to also wear multiple hats, right? They're the manager, they're the front desk person, they're their own accountant. They're dealing with insurances, and none of that are the things that they like to do.
Right, right.
So they are also going through their own burnout. So I think what really makes a team is one, looking up to your leader and having them set the tone, you know, being able to have somebody who's going to set that positive team tone, then being able to have empathy for each other. I always felt like it was a great idea to, when we had new people, like in our front desk team, for example, we would have them shadow the hygienist or the assistants, kind of follow them up for a day, just so that you can understand and have empathy when they're saying they're running behind, when they're saying that they're not available, when they're saying they can't help you. You know what their job entails. So having empathy is part of it. And then having a concise message, I think is really important, especially when it comes to patient education. Everybody been calibrated at saying the same thing, at understanding why certain procedures are recommended over others, and being able to communicate that as one, I think is really, really what makes a good team as well.
Yeah, that's great. Those are some really good components. And I think, yeah, I like your kind of spin on, or the reversal maybe, of for teams having a compassionate, empathetic view toward the doctor, because I do think that a lot of times that teams maybe sometimes secondary to poor leadership, but still there's the sense of the ownership is not, or the doctors are not always being how I would want them to be towards me. And therefore I'm kind of a victim of that a bit. I'm at the effect of that, rather than kind of what you're saying is anybody can actually take the lead in initiating a more loving, empathetic way of engaging, right? Of approaching somebody, seeing the challenges that the other people have, including the doctors, the ownership, right? They have their own different challenges. As opposed to something that can become very adversarial sometimes, like right. There is this gap and I'm here and you're there. And so I like that. So thank you for mentioning that as one of the elements of being a good team. Let's turn that for a second as we kind of head into the end of our fast evaporating amount of time here. So in terms of, those are some of the things that make for a good team. Talk to us a little bit about what you see from leadership that makes a great leader for these people that are, as you say, poorly equipped a lot of times to be able to step in and lead.
Yeah. And, you know, again, having that empathy and being able to say, oh, so-and-so is behind, what could I do to help them? And having that even for your own doctor, you know, which I learned really early, like if I could take something off the doctor's plate, don't worry about it, I'll take care of it. Just allowing them to thrive in what they're really good at, you know, what's very helpful. Recognizing what your team's strengths are and be able to say, well, so-and-so is really good about talking to patients, so let's make sure they talk to them. And so-and-so is really good with my special needs patients, so maybe we want to have them take care of them. Just identifying those weaknesses and those strengths that you have in your team. And then the other part of it, I think, too, is leadership. You have to remember that as a leader, you're there to help your team grow, not to be like, well, you're growing when I tell you, right? You want to allow them to flourish in their department and in their strength, and be able to function when you're not there, which is what I think we forget. A lot of people think I'm a leader because I make all these things happen. But when you're not there, are those things still happening?
Right.
Right. So I think for me, it's really important anytime that I'm part of a team to feel like I'm adding empowerment to my team and empowering them to make decisions, and know that we will have each other's back for those decisions, because they are now building that trust in their own strength that I recognized in them previously.
Yeah, no, that's good. That's good. And I think a lot of times the team members can be trustworthy, and associates in your stead can be trustworthy. But I do have doctors sometimes that I'm coaching where that they're coming from a place of struggling with trusting, like whether they really have most effectively equipped and empowered the people or not at some point, right? I still need to, I've done whatever the best is I feel like I can do. I do need to trust that in my absence, like you say, that they actually can function and carry on and do a great job, and that they're for me, they're for the patients, they're for the business.
Right.
And that I don't have to be there to over control it. I think those are, young entrepreneurs or new entrepreneurs, I think that's kind of a tough thing. It's like, it's their baby, right? That they were building. So it's like, I don't think you're going to do a good enough job with my baby.
Well, and again, having that empathy to understand that really nobody else is going to care as much as they do, because they're the ones who have everything invested.
Right. Yeah.
Right? Like, I probably won't lose my house if we lose the office, but that doctor probably will, right?
Yeah.
So I understand their apprehension to it. And I actually work with a doctor who, I remember the moment I started, they were like, no, like, they don't like this done. Don't do this. And just slowly demonstrating that they could trust me, and just saying, well, how about I do this? I'll show it to you before I turn it in. And then, so like creating that relationship of like, it's okay. You can trust me. I won't overstep your boundary.
Right. Yeah.
Right. I will ask you beforehand if you want me to take on that charge. But again, once I started doing this person just like, right? They were allowed to finally breathe. They were allowed to finally have somebody to say, can you do this? Because I know you'll do it as I would do it, right?
Yeah, that's great. Well, this has been great. This is thank you so much for being willing to come on and share. And I really do see in many of the perspectives that you shared how much the kind of vast array of experiences and roles that you've had inform your input, right? You've seen this from multiple angles, and I think that there's great benefit in that. So I think you have a unique message as we kind of come back to our conversation before we started even today, that I think you have a lot to offer. So thank you for sharing those insights with me today.
Thank you for leaving me the space to do it.
Yeah, absolutely. For the people who are listening who say, based on this, I need to get some more Damaury Escotto. How can they connect with you?
Well, they certainly can look me up on LinkedIn if they want to connect that way. They're welcome to do so. I also, like you said earlier, work with a big distributor for a dental company called Benco, and I'm one of the coaches with them as well. So if there's any services we could offer that way, they're welcome to inquire. But definitely, I think just doing the professional LinkedIn, send me a little message. We'll go from there.
Okay, awesome. Well, thank you again. I so appreciate your time. And I appreciate everybody's time who has been with us today. So this is Dr. Matthew Norton with People Plus Purpose, and we've been with Damaury Escotto of Benco. And I hope you've enjoyed the conversation, and we will see you on the next episode. Thank you.